Welcome to Behind the Lines, coming to you from the socialist, Marxist lines of Washington State. It's a crazy liberal petri dish for the rest of the country, folks. Stay up to date with all the great news right here. Well, to get the shot or not get the shot, that is the question of the day, isn't it? For 2021. This vaccine rollout, are you going to get it? Do you feel like it's safe? I'm not going to tell you that it's not safe or that it is safe, but I am going to read some information from some major media sources that you may not be seeing so much being put out there about some negative effects from the vaccine, specifically AstraZeneca. But this is from Como News in regards to some of these stories that are going around here recently of the bad side effects. It says Portland area health experts are trying to ease the worry of some people have as they hear about deaths after people have received a coronavirus vaccine. It says, quote, vaccines are some of the most heavily scrutinized medical interventions for safety and side effects, Dr. Jennifer Vines, the Tri-County Health Officer of Portland, said. Multnomah County health officials say it's more likely a coincidence, and the Centers for Disease Control and Prevention confirms there have been no deaths connected to the vaccine. It's interesting, though, vaccines are some of the most heavily scrutinized medical interventions for safety and side effects. That may be the case normally. However, we're using vaccines that were developed and implemented for use in 8 months. This is normally a 10-year process. I don't know, that doesn't sound like it's heavily scrutinized to me. When normally you would take 10 years to scrutinize and test something before putting it out in the public, and in this case, they only spent 8 months doing that. The article goes on to say there are still many unknowns when it comes to the coronavirus, but over the past few months, with hundreds of thousands receiving the vaccine in Oregon, some things are getting clearer. Vines says vaccines are safe, and that safety concerns you may hear about may actually be coincidental. Vines also says, as an added layer of protection, every vaccine site monitors anyone getting vaccinated for at least 15 minutes, 15 whole minutes. You're monitored to make sure nothing happens. Oh, wow. I feel so much safer. That's such a long time. She goes on to say that it's coincidence. They say that several times about these other deaths. So the U.S. is going to push that narrative. But other countries in Europe are not pushing that narrative necessarily. 6 countries in Europe now have stopped using the AstraZeneca vaccine. Denmark was the first country to announce its suspension following reports of serious cases of blood clots among people who had received the vaccine. Denmark's health authority in a statement stressed the move was precautionary and did not determine at the time being that there was a link between the vaccine and blood clots. Folks, I don't know about you, but in my life I've learned there is no such thing as coincidence. And this isn't the only country where people are experiencing blood clots. That is not a coincidence. The European Medicines Agency, EMA, said that as of March 9th, over 22 cases of blood clots have been reported among more than 3 million vaccinated in the European Economic Area. Now, I've done a report on this previously about the acceptable numbers of people having adverse reactions to a vaccine in a normal vaccine trial, and it's only a few per million. So this is still concerning. On Monday, Austria announced that it had suspended the use of a batch of AstraZeneca vaccines after a 49-year-old nurse died of severe blood coagulation problems. days after receiving an anti-COVID shot. So that 15 minutes isn't going to cut it if that came days later. Prior to this, 4 other European countries, Estonia, Latvia, Lithuania, and Luxembourg, have also suspended the use of vaccines from this batch, which was sent to 17 European countries. Denmark, however, suspended the use of all its AstraZeneca supply, as did Iceland and Norway, in subsequent announcements on Thursday, citing similar concerns. In February, South Africa also suspended plans to inoculate its frontline health workers with the AstraZeneca vaccine after a small clinical trial suggested that it isn't effective in preventing mild to moderate illness from the variant dominant in that country. And that's in a report from ABC News. Now, of course, we've primarily been told that these vaccines are effective even against the South African variant, which is spreading throughout the United States now. However, the study that they did said that it only offered minimal protection against mild to moderate disease caused by the South African variant. The variant appears more infectious and is driving a deadly resurgence of the disease in the country, currently accounting for more than 90% of the COVID-19 cases in South Africa. I'm curious because this is a report by ABC. However, most of the reporting done in this country on the news and the radio, and this report was online, but most of it on the news and the radio is telling us, go get your vaccine. It's effective against all these other variants. Don't worry. So why are we being told something completely different than what some of these other countries are experiencing or being told in their tests? It's concerning. This brings me to a report out of Salt Lake City, Utah. A news station down there, KUTV, did an investigation into COVID-19 vaccine side effects and were to report them. And during that investigation, they found 4 reported deaths by Utah families about vaccine adverse side effects. One case that stood out, and you may have seen this floating around social media, was a 39-year-old single mom from Ogden who died 4 days after her second dose. And this was of the Moderna vaccine. The family's still waiting for an autopsy. But according to the family, by all accounts, she was healthy, happy, and had more energy than just about anyone else around her. And, they posted a picture of her. She's healthy, in shape, looks completely normal. No reason to have coincidentally died from any other kind of condition. After she received her second shot, later in the evening, she started feeling not so great. And then a few days, she had flu-like symptoms, and then a few days later woke up, said her heart was racing, she felt like she needed to go to the hospital. And this lady was a surgical tech for several local plastic surgeons, and the vaccine was part of her job, and she had no issue or felt no concern about getting it. Doctors had done a blood test and stated that her liver was not functioning. Eventually, her kidneys and heart shut down, and she passed away. Coincidence? Well, looking at her and her history and what the family says, it's hard to say that's a coincidence or there was some other issue when it happened just days after getting this shot. And if worrying about side effects wasn't enough, if you're in Virginia, Chesterfield County, of course they've got some grocery stores giving the vaccine now. Some minimum wage workers out there giving you shots. Seems safe, right? Well, a handful of people went there to the local Kroger supermarket and got nothing but air in their syringes. The syringes that were to be filled with the vaccine were empty. A person who had been administering the vaccines thought a coworker had filled them. At first it was believed the syringe was filled with saline, but an investigation found they were actually empty. We apologize for this oversight and the inconvenience caused for these customers, Kroger said in a statement. Kroger COVID-19 clinics, I use that term loosely, have dispensed about 836 vaccines. Injecting air into somebody's body can be extremely dangerous. That could also kill you. I don't know. For me personally, I'm not getting this thing until I see it play out for a while. And I mean a while. I want to see what side effects arise and what happens. And I think we're starting to see now. I mean, you can go to the CDC's own website and look up the process for vaccine development and implementation, and what a long process it normally is, and all the steps and hoops and tests they have to jump through. And none of that's been done here. They fired it off in 8 months, something that normally takes 10 years. And then we wonder why we're seeing some bad side effects in certain folks. I just think, for me personally, it's a wait and see what happens, and go from there. Curious what you think. Drop me a line. Let me know what your plan is for that. Have a great day, folks. Be safe. Stay healthy. Hey, everyone. Thanks for listening to the Behind the Line podcast. I hope you will subscribe to the channel so you can get regular updates. And if you're listening to this on YouTube, I hope you will also like it, share it, and subscribe on YouTube as well. You can find us on YouTube, Facebook, Anchor, Spreaker. We're on various other podcast platforms. And you can find me on LinkedIn under John Washington. Again, thank you for listening. We appreciate your support.